Greetings. In this video, we will talk about an investigation called MCU, which is also called as VCUG. Full form of MCU is Micturating Cystourethrogram, and VCUG stands for Voiding Cystourethrogram. MCU or VCUG is an investigation in which the child is exposed to X-ray in order to evaluate the urine system, that is, the ureter, which is the urinary tubes, and the outflow of the bladder. This is what our urinary system looks like normally. It consists of two kidneys, two tubes attached to it, which goes to the bladder where the urine is stored. The function of the kidney is to filter out the waste product from the blood and to form urine, and then this urine then travels to the bladder where it is stored and is eventually relieved during voiding. Now let's try and understand, why do we need this investigation? We undergo MCU to rule out reflux. Reflux is the backflow of the urine from the bladder into these tubes. Normally, the urine travels from the kidneys to the bladder. However, in vesicoureteral reflux or VUR, or simply called as reflux, the urine goes from the bladder to the urinary tubes. To know more about this, you can check out the video on VUR. The second most common reason to perform MCU scan is to evaluate the functioning and the condition of the bladder and the outflow of the bladder. Investigations involve X-ray, but we all know that X-rays are dangerous. However, this investigation is suggested after much thinking. Therefore, the benefits of this investigation outweigh the risks involved of radiation and otherwise. Moreover, the radiologists in our institute use extremely low dose of radiation, which are called as low as reasonably allowed ALARA radiation, so that the child is exposed to minimum amounts of radiation. Now let's understand how this investigation is performed. In this investigation, first, a catheter is inserted through the outflow of the bladder into the bladder of the patient. This catheter is then connected to a bottle. This bottle is filled with contrast, which is a special kind of fluid that can be easily seen on the X-ray, and gradually the bladder is filled with it. Subsequently, the child is exposed to the X-rays so that we can have images of the bladder and the outflow of the bladder. The child will be asked to pass urine during this time. In the next few slides, we will talk about how to prepare the child for this investigation. The first way is to ensure that the child has no active urine infection. Depending upon the protocol of the institute, one may be asked to do a urine test to confirm that there is no active urine infection before the investigation. However, just to mention, clinically, the symptoms of urine infection are passage of foul-smelling urine, dirty urine, or having a fever without any particular cause. So in such children, it is important that there is no active urine infection, because if the investigation is performed with the urine infection, it can deteriorate the child's condition. Antibiotics will be recommended by the doctor to prevent any infection. The child should come in loose clothes, which are easily removable, and also with a comfort object or item that the child feels comforted by, so that he or she can feel calmer during the investigation. It's important to remember that the caregiver who accompanies the child for this investigation is not pregnant, because the X-rays can affect the unborn child. If she is pregnant, she should not be around the child when the investigation is happening. Now let's try and understand the problems that can happen after the investigation. One of those problems include burning sensation. After the investigation, the child might complain of stinging or burning sensation while peeing the first few times after the test. In that case, drinking extra fluids can be very helpful. If after the procedure there are any symptoms of urine infection, you should seek help and visit your doctor to treat urine infection as soon as possible. Again, you must drink a lot of water, and the doctor may also give you antibiotics for that. If this problem persists, or the child is facing some other health problem after the procedure, you must visit your doctor. The films of the X-ray are usually provided the same day in our institute, and you can collect your reports from the counter on the day of the visit after a few days. Thank you for watching the video.